My name is Miranda. I'm the Programs Manager with the Association of Alcohol and Other Drug Agencies, NT. What I do is work with services and support them to ensure that they're providing good quality specialist drug and alcohol services for people who might be experiencing harms associated with their drug or alcohol use. In the Northern Territory, there are over 30 specialist drug and alcohol services available for people who might be experiencing harms associated with drug or alcohol use. This ranges from residential and non-residential rehabilitation centres, counselling and support services, information and education services, and withdrawal and detox services. People can access services through their local clinic or GPs. They can also self-refer themselves if they've decided that it's time to make a change in their life and overcome some of the harms that they might be experiencing as a result of their drug or alcohol use. When accessing specialist drug and alcohol services, people can expect to work with their case manager or their specialist AOD worker to overcome some of the issues or barriers they may have experienced throughout their life as a result of their drug use. If people decide that they're ready to make a difference in their lives and overcome some of the issues that they've experienced as a result of their drug and alcohol use, that's when it's time to access treatment services. So when somebody presents themselves to a specialist drug and alcohol treatment service, they'll work with their case manager, who are highly trained professionals, through an assessment of how long they've been using drugs or alcohol, and some of the impacts that it's having upon their life. And they'll work with their clients in determining a treatment plan that's just right for them, that's individualised, looks at a whole different range of aspects of their life that they would like to set goals or overcome barriers. It's important to remember that specialist drug and alcohol treatment doesn't happen overnight, and the effect of the treatment is based on someone's motivation to engage in the treatment. Within the treatment services, people can expect to engage in programs through counselling, group work, life skills, and other therapeutic approaches such as bush therapy, music, arts and crafts, skills for daily living such as money management, literacy and numeracy to assist with regaining or re-entering the workforce, as well as other recreational activities such as sports and team building as well, to really redevelop and reconnect people with those around them, to rebuild a sense of resilience as well. Harmful ice use is an incredibly isolating and devastating experience when people feel like they've lost control of certain aspects of their life, or they can't overcome some of the barriers faced as a result of their ice use. Then this is where specialist drug and alcohol services can assist. So within specialist drug and alcohol treatment services, people can expect individualised care that's just right for them. So people will work with a case manager or a qualified AOD worker in developing an individual treatment plan. After someone completes their treatment, the case worker will continue to work with that person for a period of 3 to 6 months to ensure that the likelihood of relapse is not occurring, and we'll work with the person in some strategies to overcome relapse prevention, and to connect with other services that they might benefit from engaging with as well. Harmful drug and alcohol use can be incredibly devastating in someone's life, and they can be left feeling very isolated. It's important that they remember that there are specialist drug and alcohol services available within the NT that are willing to support them and help them to get back on track in all aspects of their life.